evening, everyone. Coach Grant here. It is my pleasure to welcome our speaker tonight, Dr. Jordan Metzl. Dr. Metzl is a nationally recognized sports medicine physician, best-selling author, and fitness instructor who practices at Hospital for Special Surgery in New York City. Among many other notable accomplishments, he is the founder of the IronStrength fitness community and platform and a proud ASICS ambassador. And it is courtesy of ASICS that we are able to have him here with us tonight. So welcome, Dr. Metzl.
Thank you so much. Thanks, Grant. And good to see you. I'll leave you up here. We can kind of chat back and forth and I'll kind of go through some stuff. So Grant, tell me who's on this call? Who are the people that, is this people that work in your store, your community? Give me an idea who's here.
This is primarily our running community. We have a very strong training program. We have about 120 people that sign up on an annual basis. And then we have anywhere from 40 to 50 people that sign up for specific race training programs. We meet twice a week on Wednesdays and Sundays. They do homework runs on their own. And I call them the weekend warrior athlete.
Oh, great. That's terrific. So that's helpful for me to know. So we certainly have people who are running enthusiasts. Maybe I'll start by just kind of talking about what's happening in the world of running from my perspective, some of the trends we're seeing. I'll go through some slides and then we can kind of answer some of the questions that people wrote in. So I guess I'd start by telling you that I kind of have several different lives. The first is I'm a sports medicine doctor at Hospital for Special Surgery, which is the world's biggest orthopedic specialty hospital, which is located in New York City. And I see patients both here and then in my offices up in Stamford and White Plains, Stamford, Connecticut and White Plains, New York. And for the past 4 months, I've seen patients all over the world. It used to be that patients that saw me were people in the tri-state area. And then I had a number of people that came in from different places, but they'd fly in. And now, as my world has really changed recently with respect to telemedicine and virtual care, I'm taking care of people from all over the place, and so that's been a real difference in respect to the being a doctor part. On the athlete part, I'm a dedicated runner and was signed up for a New York City Marathon, like I'm sure many of the people listening tonight. And I've done 35 marathons and hope to do many, many more. And a big part of my athletic career, I think, is goal setting around doing races and doing events, and that's been a challenge, obviously, and we'll talk about some of that during the Q&A. And then on the fitness side, I've done a lot of work with different folks and have started the IronStrength workout, which is kind of a whole workout we initially did with Runner's World around teaching people to build functional strength for running so they don't get hurt. That's also led to quite a bit of research around running research and prevention. And I've been lucky enough to team up with ASICS to basically combine all these different things together, both medical education and education for the community, as well as we're putting together a whole series of strength workouts. So it's been really exciting to do all that. And my main focus is to keep people on the road and running, because I think that running is very healthy for mind and body. And I think some of the trends we're seeing, we're just putting together a big research project right now at the hospital, looking at some of the different changes in running, and particularly with racing and racing on hold for a while. We've seen an increase in the numbers of runners, but they're running differently. We're seeing lots of new runners and first-time runners who are getting outside because all the gyms are closed, where we are. And people want to get outside and be healthy, so they're walking or they're running, and we're really welcoming many more people into the sport. And in some ways, not having races, certainly down here, big competitive races, has opened up running, I think, to many different people. And I think we're growing the base of the pyramid in a way. Grant, I don't know if you're seeing the same thing up there. Is that kind of similar to what you guys are seeing?
It is. Fleet Feet partnered with Brooks Running and event organizers, and are doing a big statewide virtual event where you log your miles to run across the state. And we just did an event last night helping them understand what their body is going through and some tips to keep them healthy. So we're definitely seeing that.
Yeah, and so I think that's a great trend, because being a runner doesn't mean you're fast. It doesn't mean you win. It means you just participate. It means you get out and you do it, and you do it consistently. You do it every day. You do something. That's what being a runner is all about. And so I think that's been really that's been a good thing to see. So what I thought I might do, Grant, is just jump into showing a couple of slides. I'll leave you here. And I'm going to show a few slides, and then I'll get back to some discussion. Does that sound good?
Sounds good to me.
Good. All right. So I thought I'd just kind of jump into some of this information, talking about what we know about runners and what do we know about runners. And I think it's an interesting question because we're in the process at our hospital of setting up a number of big studies around studying runners. We've done for the last couple of years of the New York City Marathon. Some of the biggest studies of runners that you'll see coming out. We've published a couple. We have a couple more that we're doing the manuscripts for now, looking at why runners get hurt, why they participate. We're actually just putting together a proposal now for a big questionnaire-based study on what people are going to feel comfortable getting back into racing and what that's going to look like. So we're learning a lot more about runners, but I wanted to go through some of the stuff we know about runners. Well, first of all, there's a very popular idea that if you take 10,000 steps a day, it's a good thing. And many people spend a lot of effort getting their 10,000 steps a day. Grant, something you do?
I have that tracking device on my arm and look at it religiously.
I love it. So the question is, where does the 10,000 steps a day rule come from? Is that like a medical thing? Is that a thing that came up at a hospital? Where'd that come from?
I read it somewhere and I didn't trust my source.
Fair enough. It actually comes from Japan, and it comes around the 1964 Olympics. The last time they were in Tokyo, they'll be in Tokyo again next summer. And the Japanese definition of the first pedometer company in Japan translates in English to 10,000 steps. And the 10,000 steps is basically a completely arbitrary number that many people shoot for. But generally speaking, the more you do, the better. But this basically wearable pedometer translates into 10,000 steps. We know that taking steps is good for you. We don't know that you have to take 10,000 steps a day, but we do know that people that run generally are healthier, they live longer, they have many less problems. The 10,000 step rule, we're not sure about. What we do know is runners live longer, healthier lives. There have been a number of big studies looking at health and longevity, heart health, particularly in runners. They tend to live longer. They tend to live healthier lives. They tend to have less cardiorespiratory illness. So basically, this is a study that was done looking at people's cardiorespiratory fitness. And what they did is they basically broke down into people by decades, and they found that the more active they were, not surprisingly, that being active over the course of their life was one of the most important health characteristics, and even was more important than some of the underlying diseases they had. So if they had diabetes, for example, running consistently in some ways trumped the effects of the diabetes, or really made those much less significant. So we know that running is great for you across the whole spectrum of your life and your lifespan. We also know that, contrary to popular belief, running does not cause arthritis at all. In fact, there's evidence that running is anti-inflammatory and can reduce the risk of arthritis. So we have a number of very large population-based studies, including this one, studying 70,000 runners over 7 years, and showed that runners have a lessened incidence of arthritis in their knees and their hips compared to the people who walked. And so the idea is that running is great for your mind, is great for your body, and we want people to do it for their entire lives. And a big part of my practice is keeping my patients and people in my community up and going. And when we look at what's happened in the United States, this is some of the trends we see. This is the trends toward our country becoming overweight, 1994, 2000, and 2010. And basically by 2010, almost a half of the United States was overweight. And this is the similar trends in diabetes, the most expensive disease in the United States. And you can see how, as people aren't moving and not healthy, they have all these different types of disease. What about running injury? I mean, we have a lot of questions about that. And so running injury. Well, I really consider running to be a contest, a war between human beings and the ground. And basically gravity always wins, but we want to give gravity the best possible fight. And so what are some of the things we think about? We think about the function of our feet and our ankles. We think about our hips and our knees. We think about the strength of our muscles. And we think about our cartilage. And all these things are things we can kind of deal with to try and really reduce the loading force between the ground and your body. So we know that there have been a number of different studies trying to figure out on where runners get hurt. And there's basically some combination of personal factors, such as how old you are, if your foot drops in. I know not a lot of people come into Fleet Feet stores and they talk about getting the right shoe. And I really strongly believe in that because we know that if you have a foot that rolls in, you're at a higher risk for injury if you don't get the right kind of shoe, as well as people making training errors. So that's why people like you, Grant, are helpful, because you hopefully keep your people from, we want to keep them enthusiastic. We don't want them to make bad mistakes of overtraining, training too much, training on the wrong surfaces, trying to do too much really intense activity at once. That's why hopefully, you know, people check in and they have a graduated training program, because those things are all really important. And we also know that people that get hurt previously, trying to figure out the right shoes, arch supports, all those things make a difference. And it makes more of a difference than running than it does from walking. We know that running puts about 300 times your body force across your hips and your knees compared to just walking. So it becomes a much bigger issue. We've been studying for a long time if there was a best way to run. And the answer is that there are a few things that we really think, which is number one, a shortened stride, high cadence run with minimal up and down, minimal side to side seems to be the least injury producing way to run. Now, everybody runs a little differently, and I don't want you to change your style to become an exact clone of whatever it is, but those are things that make a difference. And so we can talk about that during the Q&A. Strength training, having a good training flow program, recognizing injury, these are all things that can make a big difference, because, you know, if you're this guy who's an elite level runner versus you're these guys who are kind of elite level high school runners versus you're this guy who just wants to keep running and he wants to beat every 75-year-old in his age group, those are all equally important in my book. We want to keep you going no matter who you are. But the truth is there's probably not a best way to run. There are many different ways to run. There's probably no definitive best way, but there's some general trends that we can really think about. And this is one of our strength training classes in Central Park a couple of years ago. And so the things we can think about are maximizing the strength of your kinetic chain, your tip to toe strength, really maximizing your foot mechanics, maximizing your stride mechanics, keeping a nice short stride, high cadence run, and getting a good training program. These are all things that we think make a big difference for running. So with that, what I want to do is I'd love for you guys to please write in some questions. I have the Q&A box open, and I'm happy to have you ask me some questions. And I'm going to give you some answers to some of the questions that you had submitted beforehand. And the first was, is there a difference between mobility and flexibility? And that's a great question. So mobility and flexibility are two different things. Mobility is how much your joints move, and that can be related to how your joints are built. Not everybody's joints are built the same. So people are built with hips and knees that move very differently. Also, there is soft tissue and ligament tissue around your joints that give you mobility. So mobility can be loosened up with things like deep tissue release or ART or some of the vibrating guns. That can definitely help mobility a bit. But it's important to know that, you know, some of the mistakes I see in my practice are people trying to compete with the person in yoga next to them. In fact, I saw somebody today who tore their hamstring on a home video because they were trying to do what the teacher was doing on the home video, and they tore their hamstring. So everybody's a unique snowflake, and you have to make sure that you're not trying to make your mobility, you know, different than somebody else's, versus flexibility, which is basically the length of your muscle tendon unit. In general, flexibility is probably overrated. So it's very nice to be able to reach down and touch your toes. We don't think that correlates much to injury risk at all. What we do think correlates is strength. So having strong muscles is way more important than having flexible muscles. Mobility relates to how much your joints move, which can be altered somewhat. It's largely genetic. Flexibility is how flexible your muscles are. And so the question was, should we be focusing on one over the other? And if I had a choice, I think mobility probably more, but I think strength more than either of those two. Number 2 question was, how can we easily identify imbalances around our hips and glutes? And that's a great question. And what I often tell my patients is that running is basically jumping from one leg to the next, left, right, left, right. You're never with 2 feet on the ground except the beginning and the end of your run, or if you stop to like tie your shoes or something or get a drink of water. So in general, running is a plyometric, meaning the muscle elongates and contracts very quickly, and you jump from one leg to the next, all the way down the road. And so for that reason, if you have a lot of muscle imbalance, you end up starting to tilt one side or the other, and you get many types of injuries around your knees and your hips. I see these things all day long. So when I see that in my patients, the key is to start building back up their strength. And so you can have a strength imbalance if you can basically, an easy thing to do is just do a single leg squat right out of a chair. Grant, we're gonna make you our model. Why the heck not? Considering you're the only guy we can see there. So back up a little bit. Is there a chair where you are? Is there a chair? I want you to stand right in front of your chair. Can you bring down the height of your monitor just a little teeny bit, if that's doable? Good. And so is there a chair in back of you? I don't want you to fall on the ground. Good, all right. So I want you to stick first of all, I want you to stick your left foot in front of you and put your heel on the ground. Good. Your heel's on the ground, your foot's up, and I want you to sit down and stand up in that chair with your with your right foot in front of you. Good, controlled. Good, do it one more time. So your right foot should be in front of you. Your left foot should be underneath you. Is that where you are?
Left foot in front?
At this point, your right foot should be in front and your heel should be out. So
Oh, okay.
There we go. Try that. Down. So what I'm checking, just stand up and sit down a couple times. That's great. So what I'm checking for on Grant now is the strength around his glute muscles and the pelvic stability on his left side. Now do the same thing and switch legs. So have your left foot out and your right foot underneath. Your left heel should be on the ground. One more time. Now, everybody's watching this. Now, Grant's significant other there is an occupational therapist, so we have a ringer on there. But I want you to watch Grant. We're going to do this one more time, Grant. I want you to do the same thing. So I want you to put I'm going to have 2 squats on each side. I want you to watch Grant's pelvis when he sits down in the chair. So this is a perfect view. And watch him when he sits down with his right leg out. Now do the same thing with the other leg. Now the left leg is out. Whoa, good. Now, if I were watching that, I would say that I want Grant to be a little stronger in general. Hold on, you're not done yet. Go back there. I want Grant to be a little stronger in general, but it looks to me that when his left leg is out, he's a little more wobbly. That's my gut. Now we're going to find out. Scoot your chair back a little bit, Grant. Now we're going to give you the next level of challenge. Stand up. You can put your hands in front of you if you'd like. Now I want you to bring just straight out in front so we can see them. Straight out here. Perfect, good. I want you to stand up and I want you to bring your left foot off the ground in front of you. So your left foot is off the ground. Your heel's not on the ground. So stand up normally. Now bring your left foot in front of you and off the ground. Good, so your whole foot should be off the ground. Good, now I want you to sit down in the chair with that left foot off the ground if you can. Try and control it as best you can. Whoop. Now try and stand up. Okay, one more of those. Now this is a single leg pistol squat out of a chair. Let's do the same thing on the other side. And this will give us a much better idea. Thank you. Helping hand in the back.
Yes, I don't want the chair to go.
What about him? She doesn't care about you. She just cares about the chair. Good. All right. So now I have a much better idea that watching Grant do a single leg pistol squat out of a chair, his left side is weaker than his right side. And if you saw on the left side, he was kind of really falling over to the left more. And that's why I was so glad to have the helping hand. What's your name, by the way, there in the corner?
Maureen.
Maureen. So I'm happy to have Maureen there helping Grant and protecting the chair. So Maureen protected the chair, but also protected Grant, and she prevented Grant from falling over. And so if Grant came in to see me with like runner's knee, an achy knee in the front of his knee, or an achy shin, you know, I would think about Grant from the ground up. So I think about, you know, do I want to get him in the right kind of shoe to kind of make sure he's aligned? But more importantly, I would think about from the hip down, are we doing enough to strengthen him? So I would start him working on some functional strength program and exercises to basically build up all that strength. And we're actually going to be putting out one of those. We just finished writing it up and filming it. And we're going to be putting some of that information out to teach people how they can do some of these bodyweight strengthening exercises at home, which we think is really valuable for prevention. We had some questions come in, so I'm going to ask those. And so here comes some of your questions. And Grant wrote, Grant, you can ask them because you're on there too. Go right ahead.
Okay, so the first one comes from Tom. He says, as you've recently treated runners from around the world outside of your immediate practice, have you seen any similarities in challenges or injuries runners are facing?
That's a great question. So here's what I found. Runners are having a tough time with motivation if they are used to running a lot of races. I mean, you know, if you've been involved in the running community for a long time, you know, spring means Boston Marathon or, you know, whatever, London. Fall means New York or Chicago. And you kind of set what time is it in the year around some big events that kind of mark your place in the calendar. When those things have gone on hiatus, you know, for a year, hopefully that's it. All of a sudden, you're just like in this kind of vortex of where am I? And, you know, there's a little bit of, I can't mark time as well. And I think with that, we've seen a lot of our people from around the world who are used to doing a lot of events, having a lot of motivational issues, especially early on. And so that's one of the real common things with respect to kind of mood. I don't know, people can kind of chime in if they're feeling that as well, but that's definitely something we've seen. With respect to body, you know, generally speaking, a lot of the gyms, certainly in our area, the gyms are closed. Grant, are the gyms opening up where you are or not?
No, they'd hoped to open on Friday and they just got word that they can't.
So without gyms, people have been doing a lot less strength training. And that has led to a lot of overuse injuries, you know, knee problems, shin problems, Achilles tendon problems. And so doing some of the stuff I've been talking about and some of the stuff we're going to be putting out, I think is really valuable for prevention. And I think that's one of the things people aren't doing. And then finally, I'm seeing more people who've never run before or haven't run for years start to get outside and move and walk and run. That's on the good side. On the bad side, they don't have a ton of thought on how to do that. And so they just kind of get out there and they haven't done it for 20 years and they want to get it back. I saw somebody today, hadn't run for 20 years and came in with an achy knee because she wanted to get back to running, and she hadn't run for 20 years. And, you know, where she left her running career 20 years ago and where she is now are two different places. And so, you know, that's been the trend as well. Grant, if anybody else, I'll take.
Yep. Next question is from Ellen. She says at Fleet Feet, we teach good form running featuring a 180 cadence and midfoot landing. Is that the technique you are talking about?
Yeah, I'm a big fan. And I know a bunch of the Fleets had carried my Running Strong book, the book I did with Runner's World a number of years ago. And in there, I talk about cadence. And I think, you know, the goal to shoot for is 180. I think not everybody's a 180 runner, but I think 180 is about the goal to shoot for. And I'm a big fan of midfoot running. And I think it's a good starting place for people to start. But I don't think there's an exact answer for every single person. I think that's exactly right. I do see some of the problems of injury when people are trying to change their running style, you know, to become more of a forefoot striker, for example, or become a minimalist shoe kind of person when they're not. And I think making too many changes at once or making changes just because they're in vogue, I think is sometimes a problem. So I don't think there's necessarily a best way to run, meaning if you show up and not everybody's a 180 cadence runner, not everybody's a midfoot runner. And if they're not having any problems, I don't think it's really necessary to try and change them into that kind of runner. But I do think that that if all things being equal, especially if somebody's had an injury, we really try and get them towards the 180 and the midfoot landing.
Great, thank you. Next question is from Tina. She asked, does different brands of running shoes cause stress fractures / shin splints more than others?
So here's what I'd say. We are looking at that, and part of the work I'm doing with ASICS is we're going to be studying some of that stuff in our lab coming up in the next year or two, which I'm excited about. One of the things that we have learned this year is that the idea of the super cushy shoe, and there are a bunch of companies that make a really, really cushioned shoe, and those things look like they should feel great. And we found that if you're somebody with a mechanical flaw, you pronate quite a lot, and you get in a really cushy shoe or a really soft surface, like running on soft, dirt versus a harder surface, you end up rolling through much more. It exacerbates your foot mechanic, and you end up increasing your injury risk. So the idea of, I want to go to a really, really cushy shoe can in fact lead you to get things like stress fractures in your foot or shin splints. And so I don't think there is a particular brand that is the best brand. What I do think is that number one, if what you're doing is not causing any problems, keep doing what you're doing. Number two, there are many different ways to start thinking about it. Obviously, I know the most about, the ASICS development process, because, they've been at it for a long time, and their research center is incredible in Japan. But there are a number of other running shoe companies that do an amazing job too. So I don't think there's a one size fits all for every single person. But I do think the whole idea of the very, very cushy shoe and or the push towards minimalist shoes, which works for some people, but not for every single person, we've seen problems with that too. So my overall message to you is that, hop into a place like Fleet Feet, kind of try through some of the different options. And then when you start going through that, then you can start thinking about, what may work for you and what works the best, and those types of things. I think that's probably the best advice.
Okay, I've got two questions coming up that both are associated with age. So I'm not going to name names of who asked them. I've learned that early. So the first question is, as we get older, 60 plus, should we change our strength training in any particular way?
You better believe it. So I saw a woman today in my office who was scheduled to run the 50th New York Marathon, like many of us, coming up. And I said, we're going to do it next year. Don't worry. And she said, I know, but I'm 86. I saw her today. So she'll do it, but she's 86. And here's what I would say. As people age, there's something called age-related sarcopenia. You lose muscle mass, you lose muscle cells, and you lose strength as you age, and that starts by about 30, and the further you are from 30, the quicker that's happening. Running does not build strength in a meaningful way. So the further you are from 30, the more serious you have to be about your strength training. I have patients in their 80s doing burpees. I mean, I really believe in strength training across the spectrum of what you do. A couple times a week, once or twice a week of dedicated strength makes a huge difference with respect to your performance and your injury prevention. So I'm a big believer in building strength for runners. And I think as you age, you need to really commit a little more effort towards strength training.
The next question is sort of along that same line. I'm an older runner. I was just reading that as we age, the muscles don't absorb shock as well. Any suggestions?
That's exactly why. And so what I do, and what I put a whole stuff in my book, and what we're putting in our ASICS run workout is a lot of plyometric based training. So plyometrics are jump landing, like running, which is a jump land. And that, you need elastic muscles to do that. And as we age, our collagen changes and we get less elasticity in our muscles. That's why as you age, you see more hamstring tendon tears and things like that. The muscles become more brittle, but that doesn't have to be the way. It's a great chance. I think the kind of strength training I'm talking about, and these questions are definitely related, Grant, that kind of strength training that I'm talking about can really help with respect to not only performance, but a lot about prevention. So I'm a big, big fan of that.
Great, thank you. Next question is from Ed. His question is, the North American running surfaces make minimalist running less possible?
So I don't think that there's, what I would say is that minimalist, meaning kind of a zero drop between your hind foot and your forefoot, or having a flat shoe with minimal sole. I think it's more that not everybody is supposed to be a minimalist runner. And furthermore, the idea of the minimalist runner is your shoes, there's so little drop or no drop that it forces you to a more of a leaning forward position, but it also forces you to quicken your cadence and shorten your stride much more close to that kind of 180 we've been talking about. So what we like to preach with a number of our patients is you don't have to be a minimalist runner to reap the benefits from the minimalist running style. In other words, kind of similar to what your coach asked, by shortening your stride and quickening your cadence, you can do that in any shoe. And you don't have to be in a minimalist shoe to necessarily do that. Or if you do, if you're dedicated to your minimalist run shoe, you want to start with just a little bit of mileage. It takes a long time to build up, particularly posterior chain injuries. Achilles tendon injuries almost classically happen in our minimalist runners who try and do too much too quickly.
I just had somebody slide a question in front of me here. Going back to strengthening your hips, is riding a bike a good cross-training technique to strengthen those hip muscles?
Not enough. It's good for kind of lower leg muscles, quads, hamstrings for sure, and it gets joint mobility, and I think it's great to do, and I think you get an A+, Maureen, for riding your bike, absolutely. But I think the other piece is, some of these kind of plyometric jump squats, these deeper jump squats, I think those things to activate those muscles around your hips and your glutes, I think you need to make sure you're putting those into your diet as well, because you don't get enough of that from biking alone. So you need to really work on that kind of strengthening as well.
Thank you. Next question is from Brian. It says, how do you mix up your weekly schedule to incorporate both running and strength training?
Listen, running is more fun than strength training. So I try and give myself at this point, maybe one strength training workout dedicated a week where I know I'm going to do it. And even though I kind of been doing IronStrength for a long time, that plyometric based training makes a huge difference, and it's still hard. I'm still sore the next day. It's still hard after all these years. And so I just make sure I have that. It's like, I make sure I keep that in as part of what I'm doing. And I think that's real important.
We don't have any others from the group, but I have one.
Sure.
I was just watching a video from what I would call an elite athlete. And you mentioned that running techniques involves arm swing. And I was amazed at, when I was watching this runner's gait with the arm swing, how much it was engaging their core. How best to get that core healthy and activating like that?
Yeah. So, and I'll make sure that we send you, when we finish our program at ASICS, we'll send it to you, because again, I think that's part technique, and it's a lot, full body strengthening. So, things like burpees, which are terrible, but they're so effective for total body strengthening. I think runners need to be doing that kind of stuff. Runners need to be doing full body strength at least once a week to allow them to really utilize those muscles. Because if you just build up your quote unquote running muscles to the exception of everything else, then you end up, stronger in some areas and a lot weaker in others. And so that's why I think committing to that kind of stuff becomes really, really important.
Great. Another question just popped up here on the screen. It says, a question about diet. Have you seen any differences in athletic performance between vegetarians versus non-vegetarians? I wonder.
So that's a good, yeah.
I wonder how a plant-based diet impacts muscles performance, etc.
That's a great question. We don't know. There's not really been much, except for making sure, if obviously you're a vegetarian, you're getting enough protein sources in your diet. But insofar as the plant-based diet in and of itself is performance enhancing, we have no evidence that's true. What we do know is trying to get your BMI into an optimal number for you will certainly help your running. But that, that can happen if you're eating meat. It can happen if you're eating plant. It really is a lot about trying to get a well-balanced diet and trying to get your BMI into a range that works best for you. And it is true that people on plant-based diets tend to have lower BMIs than people on not plant-based diets. That's true. So it may be an indirect consequence of just having a bit lower BMI if you're on a plant-based diet, but that does not necessarily mean you have to do it that way.
Great. Thanks for the question, Lisa. Next question is from Ed. Do you use multiple training shoes for the different running? And what is your go-to ASICS running shoe?
Sure. Well, you know, the nice thing I think about ASICS in not only in how they develop their shoes, but in the kind of whole host of different shoes they have is, you know, they have kind of their, when I was in Japan, I met Kayano-san, who developed and named after the Kayano, the gel Kayano, which I love. That's my high mileage shoe. And I love those because they last for so long. And at ASICS, they have a wall where they have like all the Kayanos. Now they just released number 27. So they have numbers 1 through 27 lined up all the way in a wall. And you can see the different changes and modifications they've made over the years with all the different ones of their shoes. So that's pretty cool. That's my high mileage shoe. And I use that when I'm training. That's probably my biggest use shoe. And then they have some of their newer shoes and some of their lighter shoes that I do for different kind of shorter distances. They have, you know, they have a whole kind of host of those different things. And you know, kind of everything from lighter to heavier to more, you know, sleek to more cushioned. I would say one thing is that there's always a balance if you want to try and control people's foot mechanics between the amount of control in the shoe and the amount of control of the foot in the shoe. So the amount of control in the shoe is something like a Kayano, which has a lot of medial posting, so you can't roll through. So the sole itself is correcting your foot mechanic, versus one of the shoes without as much control. Then we can get people like into some kind of orthotic or arch support in their shoe so they don't roll through as much. And so sometimes people need more of an orthotic in a shoe that doesn't have as much support. And so those are things that we try and play with as well.
Thank you. Maureen's going to write in one more question here.
All right, Maureen, what do you got? You can just ask, Maureen. Don't, you know.
Thank you. So I'm wondering if you can share your strength training regime in terms of, do you start at a low weight and increase your reps, and what is the rate that you increase weight and reps, and do you then maintain it?
So Maureen, you'll see when we, I do either body weight or I only use the max at 15 pound dumbbells. That's it. And all the strength workouts I've put together, you know, I think the strength acquisition from high rep lightweight training is almost equivalent to the strength you get from kind of pushing heavier weights. And so the whole idea of ramping up, you know, people that want to build muscle bulk will do better if they push more weight. People that want to build functional strength will do better if they push high reps of a lightweight. And so, you know, for example, you know, 4 sets of 15 plyometric jump squats is going to really build a ton of functional strength around your glutes, quads, hamstrings. I think even more in many ways than trying to squat, you know, some number of pounds. And so that's where I tend to really push people. And the other piece is for runners, if you build up too much muscle bulk, it really does affect that question at the beginning, both flexibility and mobility, and those can be problematic to your running stride. So I think both for efficacy and for function, it's better to do it that way.
Thank you.
No problem.
So that's all the questions I have here. Were there any that you had been sent that you want to address?
No, I think we got to most everything, and I think this was kind of a good you know, starting overview of some of the different stuff. I guess I would just close by saying, number one, thanks so much for having me. And number two is, I think it's challenging for people right now because there's a lot of stressors in the world. There's a lot of, you know, negative news, and running is really important, and important in a different way. It's not, you know, getting your BQ right now. It's like keeping your sanity and keeping your health and, you know, making your immune function the best it can be, and all those things. So I want to really encourage people to get out and run. Don't be discouraged about the fact there may not be some big organized races for the moment. That the message I want to give everybody is, as a doctor and as a runner, it's so important to stay out there on the road and don't be discouraged, and keep yourself going and figure out what motivates you. If it's, you know, if it's virtual races, if it's, you know, virtual groups, if it's small running groups that are socially distanced, whatever it is that's good for you, I'm good with it. And hopefully it'll keep you on the road.
Thank you very much, Dr. Metzl. I am so good at plugging up. Wait, did we just have one more question pop in? Oh, one quick question from Tom. Where can we find your upcoming strength training videos?
So ASICS will be sending all that stuff through you guys, but if you go to my website, drjordanmetzl.com, I have a calendar, all of our different events. We put our virtual events up there so you can register for some of our virtual strength training classes. We have one this Saturday morning. Everybody's welcome to join. And so we'll be posting those there. And then as the work and the strength training offerings become available, you can find them there as well.
Great, thank you. Again, thank you. I'm so good at plugging sponsors. I let one slip from another company during the intro, so my apologies to ASICS. And I'll just share, I was doing a fit recently with someone that jumped brands once they tried on the new ASICS Cumulus. So they're sending out some good product, and thank you for all of this, and all the best to you.
Terrific. Nice to see everybody, all right?
Thank you.
Thank you.
Bye-bye. Sure.